Let's speak to Arisina Ma, who's a doctor and president of the Hong Kong Public Doctors Association. She's on Skype via Hong Kong. Thank you very much for joining us. There is clearly a dilemma for governments here and different opinions as to whether this is the right time to start easing restrictions. What do you as a doctor believe should be the indicator for governments to decide that it's okay to lift restrictions?
I think it just depends different between different countries. But I think, first of all, we must see a very clear sign that there is no new clusters of new cases appear in that country. For example, like Hong Kong, we have almost like 14 days, 15 days with no new local infected cases. So that gives the confidence to government as well as the public to ease some of the lockdown measures. It also depends whether the public healthcare system they get well prepared for the second wave of disease, whether they have already recovered from the first wave, whether the government have enough quarantine facilities to quarantine those newly confirmed cases again, whether the contact tracing measures has been prepared. Once there is another single cases, they can trace the contact and quarantine everyone in a very quick phase.
So you're saying that you base the easing of restrictions on the number of new cases, but for what period of time?
Usually, if in theoretical for any infective disease or any infective disease that may cause a big public concern, the best way is we take 2 incubation period of that disease. For the nCoV, mostly we believe that the incubation period of the disease is 14 days. So the safest way to observe is 28 days. If there is no more new cases, especially no more new local confirmed cases in 28 days from the last cases, you can say it is pretty safe. The city may have it's been a very low risk for another new cases.
So what about when it comes to avoiding a second wave of infections? What should government strategy be?
First of all, I know that some countries who may have a quite good result in the local control, they are more eager to unlock the city. But I think, as globally, the condition has not been settled well. We know that in some countries like Russia or South America, they still not their condition has not yet peaked. So I think international travel, the flight should still be under control and restriction. For the I think for government who want to unlock their city, first of all, they should have a well plan of contact tracing, a well plan for quarantine facilities or isolation facilities is available once the confirmed cases happened again, because early contact tracing, early isolation, and early quarantine is the best way to prevent another wave of a community outbreak.
Thank you so much for speaking to us. Arisina Ma is the president of the Hong Kong's Doctors Association. Thank you for your time.